It's me again, Nica. For today's video, we will talk about ATNR, the symmetrical tonic neck reflex. So if you are interested, just keep on watching. So let's talk about ATNR, or the symmetrical tonic neck reflex. So ATNR was a primitive reflex that babies exhibit, and it is part of the development of muscle tone, consistent one-sided movement of the body, and even proper hand-eye coordination. ATNR begins while a baby is in the womb and can be seen as early as 18 weeks during pregnancy. This reflex may help babies move through the birth canal during vaginal deliveries, and it usually disappears between 5 to 7 months of age. It was important to disappear at these months of age because if not, it may affect the developmental milestones of your child, like crawling. That's why physical therapists, the movement experts, has an ATNR assessment. So this assessment is for us to check if this reflex was still present on the child, and if yes, determine how it will affect the developmental milestones of the child, such as crawling. That was commonly the problem about this reflex, resulting to the late development of the child. So let's say a 1-year-old child still can crawl because this reflex was still present on him. That's why every time he tries to turn into prone position, it won't be successful because his arms, where his head was turned, will always raise and block the stick. The baby cannot crawl, it cannot sit down. And if the baby cannot sit down, it cannot stand. And if the baby can't stand, it can walk. This assessment is commonly used for patients at the pediatric age. So it was part of the procedure to have at least 5 minutes of playtime with the child, so the child will become comfortable with you during the treatment. But in this video, we will proceed on the assessment. So without further ado, let's get started. So for this assessment, the patient must be on the supine lying position, and the position of the patient's head must be on the midline, and the PT carefully turns the head of the patient on the one side and observe for the response. So for the babies under 7 months of age, the expected response must be raising his hands where the head was turned and the other side of the hand was bent. So like this. So at this position, so the hand where the head was turned was raised and the other side of the hand was bent. So this is why this reflex was also called fencer reflex, because it was the fencer's pose. While for about 7 months of age, so the expected response must be, it was fully integrated at this moment, because this typically disappeared at 5 to 7 months of age. Procedure will be repeated on the other side of the patient's body. So I will end here this video. I hope you learned a lot. See you on my next video. Have a nice day. Bye-bye!